Good afternoon, everyone, and welcome to today's webinar. My name is Isabel Garcia de Quevedo, and I am a CDC evaluator and a project officer. And we're here to review the technical assistance offerings available to 2109 recipients. Before we start, I'll let Courtney talk a little bit about the interpretation services we have, and then we'll jump right in.
Hi all and welcome. I just want to let everybody know that live Spanish interpretation is available throughout this webinar. You can access this by going down to the bottom of your screen, selecting the little globe in the Zoom controls for interpretation, and then it'll give you an option to select Spanish or English. And if you want to view the Spanish channel and hop to that room, click the Spanish button. Thanks.
Thank you so much, Courtney. So like I said, thank you so much for joining this webinar. We are very excited to provide all the technical assistance offerings that are available to you. Next slide. And so here you can see the objectives. By the end of our time together, we hope that you will have a deeper understanding of the type of technical assistance, or TA, as we will call it from now on, that is available to you as a 2109 recipient, and how you can gain access to TA through CDC's Award Management Platform, or AMP. If you have any questions during the presentation, please type them into the chat, and we intend to address all the questions at the end of the presentation. Next slide. So here you see 6 types of TA categories. All the TA provided to 2109 recipients should be documented in AMP. There are 6 TA categories available to 2109 recipients, and you can see them here in our budget and administrative, evaluation and performance measures, communications and media, program implementation, training, and other topics. If you know that you will need assistance, but you aren't really sure how to articulate your need within the available categories, you can always discuss with your project officer first, just to see where it can fit in these categories. And your project officer will determine whether to submit, or they can even submit the request on your behalf. The TA cases will vary in the type of engagement required. Some requests may be quick, some others may be better suited for longer term engagement, and both types can be requested and should be requested in AMP. The TA may be provided by CDC staff member or one of our TA providers funded by our 2110 NOFO. Next slide. And on this figure, you can see our 3 CCR evaluation and technical assistance recipients who are funded to provide 2109 recipients with programmatic and evaluation TA. So on the left, you see Wisconsin Department of Health Services and their partners, which are called Envision, and they provide support for training and program implementation topics. And on your right, ASU and WASEP, or Arizona State University, and WASEP provide support for topics related to evaluation and performance measures. Next slide. And the rest of today's presentation will focus on the types of TA available from our 2110 TA providers. And this fall under evaluation and performance measures, program implementation, and training. Next slide. And now, please allow me to introduce Mr. Darrell Fox from the WASP team and Dr. Dana Hunter from the ASU team, who will go in more depth on the types of evaluation and performance measure TA available to you.
Thank you so much, Isabel. And again, welcome everyone. And as Isabel shared, my name is Darrell Fox, and I've served as a community health worker for over 30 years. And since the beginning of the CCR project, I've been honored to serve as a co-principal investigator for the Washington State Evaluation Partnership, which is comprised of several partners, including the Washington State Department of Health, my agency, which is JSI Research and Training, the Common Indicators Project, and Pilar Consulting. At every step, we work collaboratively with the CDC, Envision, and the ASU team. The WASP partner organization teams and several subject matter experts who support our teams collectively have decades of experience in evaluation across the full spectrum of evaluation frameworks, modalities, styles, and we embrace participatory, equitable evaluation principles and practices. As part of equitable evaluation, engaging those affected, including CHWs and populations with lived experience who are being served across all stages of evaluation, is very important to us. So including such representatives from the start of evaluation planning teams and ensuring they contribute to methodology, including tool development, recruitment, analysis, including assisting with interpretation of findings, communication plans, action plans to use those findings are also very key to us. During this portion of the presentation, your co-presenters will be myself, representing WASP, and Dr. Dana Hunter, a co-investigator representing a great team at the Arizona State University, also known as ASU. Momentarily, you'll hear more about ASU. We will both be sharing information about our evaluation technical assistance teams, and we will familiarize you with our team's composition of providers who may be available to you, and also some of them may already be working with you related to your TA requests that you have shared through AMP platform and by other ways of communication. We will also discuss the wide breadth of categories and types of evaluation technical assistance that our TA teams have made available to all 2109 participants from the start. Before I turn the microphone over to Dr. Hunter to introduce you to the ASU and to the team, I will take a brief moment to introduce you to some of the members of the WASP evaluation TA team. Next slide, please. Thank you, buddy. On this screen, you will see the Washington State Evaluation Partnership, also known as WASP TA team, including two of the WASP principal investigators, myself and Rudy Vega, who has many years of experience in community-based evaluation. The team includes a team of evaluation TA liaisons from two of WASP's key partners. Those are Common Indicators and JSI. The liaison team is here on the screen, and they are supported by and can enlist the support of many others on the broader WASP team, including subject matter experts in key areas of evaluation and other WASP team members from the Washington State Department of Health, JSI, Common Indicators, and Pilar Consulting. Our team that is available to support your 2109 TA needs is comprised of evaluators and liaisons who are CHWs, CHRs, promotores de salud, and CHW allies who have decades of experience providing comprehensive evaluation services and technical assistance domestically and internationally. Dr. Hunter and I will provide some brief information about the evaluation TA our teams collectively have made available to you, all of the 2109 participants. I now want to turn the microphone over to Dr. Hunter of the Arizona State University team to tell you more about ASU and their team. Next slide, please.
Thank you, Darrell, and good afternoon, everyone. The evaluation team at Arizona State University is honored to serve alongside the Washington State Evaluation Partnership, also known as WASP, to assist the 2109 recipients in their evaluation TA needs. The ASU Office of Community Health Engagement and Resiliency, also known as OCHRS, eval team is led by Dr. Mary Ellen Brown, who serves as the Director of OCHR and principal investigator on this project. Dr. Brown brings years of experience in developing and implementing evaluation and action plans for community-based projects. She has also assembled a strong team of leaders with years of experience and expertise in providing equitable and culturally responsive evaluation consultation with and on behalf of marginalized communities. The ASU team consists of experts, statisticians, researchers, evaluators, community health workers, subject matter experts, and those experienced in graphic design, social network analysis, and geographic information system mapping or geomapping. Now, I know that some of that may sound technical, and if you can go to the next slide to show the other half of the team, thank you. I know that some of that may sound technical and somewhat intimidating. So Darrell and I will try to share in a more simple fashion ways that the 2109 recipients can engage our collective teams in providing you with evaluation TA. Next slide, please. There are 7 key areas of evaluation-focused TA that our eval teams can provide: participatory and equitable evaluation, evaluation frameworks, data collection and management, data analysis and interpretation, performance measures, dissemination of findings, and specialized evaluation considerations for diverse populations. Next slide, please. Participatory and equitable evaluation. 2109 eval TA partners, we can provide consultation on principles and practices to guide culturally responsive, equitable, and participatory evaluations tailored to each project's initiatives. As you go about data collection activities and other methods to evaluate your progress, you may want to ensure that your activities are participatory, equitable, and culturally responsive. You may ask, are there additional strategies that we could use to ensure we're being inclusive of those with lived experiences? How do we apply principles of people's education in a community where there may be survey fatigue, language barriers, or vast cultural differences? If you would like to have conversation around these topics or others, such as CHW engagement and leadership in evaluations, communication and action plans, community ownership of evaluations, community of practice participatory framework, or collecting participant impact stories, feel free to submit a TA request. Next slide, please. Our eval team can also provide consultation on identification of participatory evaluation questions, paradigms, design, and methods, conceptualization and development of methodologies used to assess program processes and outcomes. Perhaps a 2109 recipient may want to know if the method selected is appropriate to gather the information needed for assessment and want to have some discussion around that, or get recommendations on a more suitable framework and method. Is it trauma-informed? Our eval team stands ready to provide guidance on developing and implementing trauma-informed evaluations, inclusion of the CDC evaluation framework, evaluation of COVID-19 public health interventions, summative evaluation and assessment, logic models or theories of change, and more. Next slide, please. We can also provide consultation on best practices for gathering and maintaining program-related data. 2109 recipients may have questions regarding conducting focus groups and key informant interviews with a specific racial or ethnic group in your catchment area. How to develop a survey instrument to capture specific information related to gains in CHW knowledge, skills, behaviors, or things to consider when developing survey to assess the effectiveness of an intervention to reduce the spread of COVID-19? How do we use digital storytelling and photo voice to empower community members and CHWs and better understand their needs? The eval team can provide consultation on these topics and others, such as document reviews, observational studies, oral histories, and more. Next slide. And lastly, our TA partners can also provide consultation on best practices around gathering and maintaining program data and utilizing public data sets. The eval team has collective experience with the following data sets: behavioral risk factor surveillance system, census data, clinical quality measures or CQMs, electronic health records, National Health and Nutrition Examination Survey, National Health Interview Survey, and more. If you need guidance on how to access these resources, how to extract specific data from a larger data set, or other questions related to these data sets, please don't hesitate to reach out. Also, if you need assistance developing a clinical or community referral system, an informed consent form, need guidance on ethics and evaluation, or simply would like us to review an application for data collection, feel free to submit a TA request and we will gladly assist you. At this time, I'll turn it back over to Darrell, who will discuss the remaining categories of available TA offerings. Darrell.
Thank you so much, Dr. Hunter. And as you keep seeing, we're opening this door and availability. Just please reach out to us at any moment. We stand at the ready to assist you. Related to data analysis, next slide, please. Sorry, Clay. Related to data analysis and interpretation of our evaluation, our evaluation TA teams can provide consultation on theoretical approaches to and technical procedures for evaluating and interpreting program data. Our evaluation team members have expertise in the areas and types of data analysis and interpretation topics you see on the screen, including qualitative analysis, data-informed decision-making, to name a couple, and we have many more that are not on this slide that we can assist with. Our evaluation TA team members are available to work collectively with your local 2109 evaluator and project team members to provide assistance in the many data-related areas that we list here, and we can also provide additional links to external resources to assist with analyzing data or obtaining psychometric properties of survey instruments to assess their validity and the likelihood of ensuring that you truly are measuring what you set out to measure. Next slide, please. We also, here we go. In addition to our availability to provide TA related to participatory evaluation frameworks and data collection, our evaluation TA team can offer advice on how to gather performance measures. And any 2109 recipient can request individual TA meetings with our teams via AMP. The evaluation TA teams have worked collaboratively with the CDC to offer office hours and trainings on performance measures. We have and can assist with reviewing your submitted performance measure reports by using a feedback rubric that's really designed in partnership with the CDC to help guide and organize feedback in ways that we feel are the most helpful and useful to your teams. You also have the opportunity to schedule meetings post your performance measure submission to review those rubrics to help address any areas of need for improvement or enhancement. And please remember, we're here to answer your evaluation questions. Our teams are here for you, and it's really on your timetable and based upon your needs and your timelines. Next slide, please. Evaluation TA partners can also provide consultation on ways to share your findings with different audiences that you identify as important audiences to share your findings and that you might want to customize reports for. Again, once you have collected and analyze the data, our teams can give guidance on the best approach to sharing back results and with the steps involved in developing peer-reviewed manuscripts, white papers, etc. Some examples of dissemination topics include assistance with the development of papers for peer-reviewed journals and other publications, and reports for dissemination to specific populations. We also can provide samples to assist with development of policy groups. We can provide referrals and information on digital delivery providers to assist with development and management of websites, social media platforms, and other platforms that you may want to use to help disseminate your findings to the right people. We have graphics and visualization experts on our team and can share information on external sources as well to assist you in data visualization issues, writing reports, developing presentations, and disseminating your finding through whichever platform and modalities that you choose. Next slide, please. We can also provide consultation on strategies for specialized evaluation considerations for diverse populations. As we know, this is critical to design evaluation based upon some of those cultures in diverse populations. 2109 recipients may face obstacles in program implementation and data collection with some populations, including those you see listed here and many more. Our evaluation teams can assist with strategies on engaging different populations, working with them collaboratively to empower some of those special populations, including CHWs and tribal communities in which many of our members are part of, by building trust to really truly help implement community and culturally responsive data collection and evaluation activities that are critical when working with various ethnic and racial groups. And we have many examples of how the fact that our team diversity has really truly been able to inform evaluation in a truly culturally responsive way. And we are here to work with you and share some of that knowledge. WASEP and ASU's evaluation teams have collective experience and expertise across many, many special populations that could help you think through some of the challenges and brainstorm strategies to assist in engaging as optimally as you can those special populations, which is a benefit to those populations, our communities, and to this project and our programs. Next slide, please. As we close, I just really want to reiterate, jump on the table and just say over and over again that the WASEP and ASU evaluation teams collectively stand ready to partner with you in a collaborative way and assist you with implementing equitable, participatory, and culturally responsive evaluation plans. I'd like to reiterate that no question that you want to pose to this team is too big or too small, because we think they're all important. If you're asking, there's a reason why you're asking, and that reason is valid. We are here to assist you and ease any burden related to some of the evaluation duties that you may have. The CDC will share and post to AMP the 2110 Evaluation Technical Assistance TA Offerings menu. And this will include the information we've shared today and much more. So once again, we're here for you. You have a liaison or a team member who is assigned to you, who's building a relationship with you, who's here to assist you and to coordinate responses from the rest of our team members. We work together across our ASU and WASEP teams with our varied skills and experiences. There's probably nothing that one of our team members has not tackled in the past, so we can assist you with that. We have also many subject matter experts who stand also at the ready to assist our teams and your teams with evaluation TA requests. I want to thank you for your time, Dr. Hunter. Thank you for representing our ASU partner team. And now I'd like to turn the microphone back over to Isabel. Thank you, Isabel.
Thank you so much, Darrell and Dana. I would now like to introduce Ms. Lisa Renee Holder-B-Fox from the Envision team, who will describe the types of program implementation and training TA that are available to 2109 recipients.
Thank you. Next slide, please. Good afternoon to everyone. Good morning, depending upon where you are. I'm going to talk today a little bit about the offerings from Envision. And I just want to share that Envision is comprised of several partnering organizations, Match, LSU, and the Center for Community Health Alignment. Our training component is led by our partner Match. The resources component is a collaboration of Match and the Center for Community Health Alignment, or CCR. And our technical assistance is led by CCR. And today I'll be focusing on the technical assistance component. Next slide, please. Envision is comprised of many core partners and technical assistance team. And I'd like to take a moment to introduce the team to you. You have myself, Lisa Renee Holderby-Fox. I'm the Envision co-director and I lead the technical assistance team. And I have the pleasure of working with two amazing CHW program consultants, Erin Capel and Lynette Walker. And we could not do the work that we're doing without the additional support that we're getting from our co-workers at the Center for Community Health Alignment, Julie Smithwick, Andrea Haywood, and Maria Martin. And I want to share that we are all based in various areas of the country. I'm based in Georgia, Erin in Delaware, Lynette in Wisconsin, and the team, Julie Smithwick, Andrea, and Maria, are all based in South Carolina. Next slide, please. I'd like to share a little bit about who we are and our collective experience. Collectively, we have the Envision Technical Assistance Team has over 110 years experience as CHWs or CHRs. We have founded or co-founded 11 CHW organizations. We've developed 55 programs. We've developed or co-developed 13 CHW curricula. And lastly, but not least, we've provided more than 65 years of technical assistance to 165 programs or organizations. Next slide, please. We can't do this work alone. Envision has an amazing CHW council with a depth and breadth of experience. We also have additional CHWs and CHW allies, subject matter experts, and there are additional staff at CCHA that we can also draw from who have amazing expertise as well. And all of these connections help to enhance the TA support that Envision can offer. Next slide, please. I mentioned the CHW Council, and I'd like to share just a little bit about them. Like the core TA team, the CHW Council members are CHWs with expertise on all levels of CHW work. They meet on a regular basis and provide guidance to Envision's work. We currently have 7 members, and we are expanding to include 5 additional CHWs from CCR-2109 recipients and or their partnering organizations. And I just want to share that the deadline for nominations is Tuesday, October 25th. And all nominations for additional members of our CHW Council must be made by a CCR-2109 recipient organization. Next slide, please. The TA offered will support the uniqueness of each recipient, and all TA is framed with an equity lens and uplifts the expertise of those with lived experience, seasoned CHWs, and our allies. We work with the CCR-2109 recipients to support your success. Our TA is conducted in coordination with your program project officers. And as a way to ensure all TA requests can be answered in the most appropriate manner by the most appropriate team, all requests must be submitted via AMP. Next slide, please. I just want to offer a quick snapshot of the TA that we can provide. As you heard earlier, requests can be longer or shorter engagements by the team And I'd like to offer a couple of examples of these. Short term could be a request for documents or a toolkit to support your work. A longer term engagement could include developing processes like workflows or co-creating materials with you all. And all TA is provided by subject matter experts. Next slide, please. There are 5 areas of TA that Envision provides: preparing your program for CHWs, recruiting and onboarding CHWs, professional development for supervisors and CHWs, supporting CHWs generally and program implementation, and finally, sustaining CHW programs. Next slide, please. I'd like to share a few examples of programmatic support available through Envision. Introducing CHW roles and responsibilities, we've had a lot of requests for this. Integration into teams or new teams and or engaging CHWs in program implementation. Assistance to maximize CHW contributions to the work. Best practices and resources to recruit, hire, and retain CHW staff and supervisors. Providing supervision to CHWs often has nuances, and we can assist you to ensure that best practices are utilized. We're also available to offer support to partnering organizations. And please note that any request to assist with partner organizations must also come through AMP and be submitted by the CCR-2109 recipient. Next slide, please. There are also 5 areas of training TA that Envision can provide: understanding best practices for CHW and supervisor training, connections to CHW core competency training, and also supervisor training, access to CHW certification requirements where available. CHW certification is not available in all states across the country, but where it is available, we'll make sure that you have access. Training of trainers, preparing CHWs to train others, and topic-specific training. Next slide, please, Courtney. I'd like to share a few examples of types of training support that we can offer. Within the skills and knowledge bucket, COVID-19 and chronic diseases, motivational interviewing, home visiting preparation, patient-centered action planning. And there's also support for training around working with focused populations that have been identified by the CCR-2109 recipients, such as working with rural residents, farm workers, youth, older adults, and we have deep expertise working with racial and ethnic populations, including indigenous peoples. I also want to say that this is not an inclusive list of the TA training support that we can offer. We're just giving you a sample. Next slide, please. I also wanted to take just a few moments to talk about a few possible scenarios where TA can be provided. I'm hoping that this will give you an idea of where and how Envision can be helpful. Recipient A is creating and delivering a CHW curriculum and wants to ensure they utilize best practices to deliver and develop CHW training. They've asked for assistance from Envision by creating an AMP request. An Envision program consultant is invited to a monthly meeting by recipient A's project officer to gather additional information. Envision responds to the request by providing guidance and resources on best practices. Next slide, please. Another potential scenario where Envision could be helpful: recipient B wants to assist their community partner with CHW staff retention. Their project officer wants to engage Envision to develop a retention plan. And this plan would include developing opportunities for professional development for CHWs and CHW supervisors. An AMP request is created. Envision responds to the request and participates in several monthly meetings to assist with resources and provide expertise. It's also important to note that as more TA needs are identified, additional requests can be made in AMP. We hope these scenarios will give you a general idea of the potential ways that Envision can be of assistance. Next slide, please. I'd like to stress that the TA team believes in the true power of collaboration. Having as many partners in the work at the table strengthens the partnership and its success. And we'd like to remind you that this could also include and should include those doing the work, the CHWs on the ground. Next slide, please. We're very excited to work with you, and using AMP is the best way to have your TA needs met. To submit a request for Envision TA, once in AMP, please select either program implementation or training, depending on your need. It's going to be important to include as much information in your request as possible. This will assist your project officer to determine how Envision can best assist you. And if you'd like to learn more about Envision, I'm going to encourage you to please visit our new website at www.envisionequity.org. And thank you so much, and we look forward to assisting you. I'm going to hand this back to Isabel.
Thanks, Lisa Renee.
Oh, thanks, Hope.
Good afternoon, everyone. My name is Hope Thompson, and I'm a health scientist and project officer at CDC. And today I have the pleasure of walking you through how to create a TA request in AMP. As a complement to what I'm going to present, there's a TA case training video also available in AMP, and it can be used as a reference. And we're now dropping that link into the chat. So to create a TA case, first log into AMP. All directly funded 2109 recipients have at least 2 AMP users who are able to submit CCR TA requests. If you don't have access to AMP but would like to submit a TA request, please reach out to the CCR principal investigator or program manager for your reward. Next slide, please. Once in, navigate to the TA request tab on the top navigation bar that's highlighted in red here. Next slide. Look through the content of the TA cases that are already there. If no existing TA case matches your question, create a new TA request by clicking the New TA Request button at the top right of the page, also highlighted here in red. Next slide, please. On the left side of the page, there is a form to create a TA case. Complete the required fields on the form, including the component, category, subject, and description. At the bottom of the form, any supporting files can be uploaded to the case. Now, a few best practices to keep in
Did everyone lose hope like I did? Okay.
Yes, ma'am.
I'm seeing some head nods. Let's give it 1 second to see if she unfreezes, but otherwise I'll pick right up where she left off. Thank you all for the affirmative responses in the chat. All right. I will go ahead and pick up where Hope was. My name is Kara Abshire. I use she, her pronouns, and I'm a health communication specialist here at CDC. So as Hope was saying before we lost her, there are a few best practices to keep in mind when completing your TA request. The TA categories available to 2109 recipients, Isabel showed at the beginning of the presentation. As we talked today, it includes budget and administrative, evaluation and performance measures, communications and media, program implementation, training, and other. Please select the category that aligns most closely with your TA request. And don't worry about submitting a TA request. If you aren't sure which category is best, pick the one that feels like it's closest. So for example, if you have a question about your program's evaluation budget, go ahead and select budget and administrative. Selecting the right TA category allows TA providers to more quickly address your needs. But when in doubt, go ahead and get that TA request in. As I believe Lisa Renee mentioned earlier, please be as descriptive as possible in the subject and description fields. The more detail you're able to provide in the initial TA request, the quicker TA providers will be able to accurately respond to your request. The last step then is to hit submit. Can we move on to the next slide? And also, Hope, it looks like you're back with us. Would you want to take over from here?
Sure. I'm so sorry, lost connection there, but thank you for stepping in, Kara. So once successfully submitted, you'll see a green pop-up that says TA has been created at the top of the page. Below that, a case summary with a subject, description, and case number is available. You can click the case number to review the case you just created. And you'll also see an acknowledgement of your request in AMP within 2 days, and then the initial follow-up will take place in AMP as well. So it's a good idea to keep checking AMP to make sure that your request has been received. Next slide, please. Okay, this brings us to the end of our presentation for today, and I want to thank the 2110 TA providers, Darrell Fox, Dana Hunter, and Lisa Renee Holder B. Fox for their participation. Also, thank Isabel for her participation as well. And we're ready to take your questions. So I'll now turn it over to Kara, who will facilitate our Q&A.
Thank you so much, Hope, and thank you to all of our presenters today. There are a couple of questions that have already come into the chat, but while we're getting started with those, if you have a question that you'd like to unmute for, you're welcome to raise your virtual hand. Under the reactions button, you can select raise hand, and I'll try to call on folks after we get through some of the questions that have been put into the chat. I want to start with a question that I believe would be going towards Dr. Hunter and Darrell, if you all can be on call. Linda typed in the chat, can you please talk more about photo voice, digital storytelling? Would either or both of you like to speak more about that?
Sure, I can, if Darrell, if you don't mind, and you can jump in if I leave something out. But in short, digital storytelling and photo voice, they're participatory research tools to help those in the community and those from marginalized communities tell a story from their perspective. So photo voice, for instance, they go into the community, they're provided with a camera, and they take pictures of areas that they would consider a strength, or they would consider a need, or a soft spot, an area that needs improvement in their community. And then there's a meeting that takes place to kind of talk about, okay, so it prompts discussion around, so why did you say that this is a need? So it helps us to understand, to get data from the perspective of those from the community. Just powerful, powerful tools. And we have members of our team who can, with expertise in those research skills. Darrell, did you want to hop in?
Excellent, Dr. Hunter. I also know that's a very good opportunity for us to talk about collaborating with the Envision team. There was an Envision webinar that I believe is recorded, you have access to, just about storytelling, and then the storytelling, photo voice, digital storytelling, they're all connected, and there are several tools across our teams on the evaluation side that can assist with those. and may have a session in the future if there's interest from the 2109 teams. Thank you, Dr. Hunter, and back to you, Kara.
Thank you both. I'm going to keep you on call if that's okay, because I think our next question that's come in is a great fit for you both also. Teresa typed a question in the chat and then had to step away, but I think it's a great question. So I still want to pose it for the group, and hopefully we can follow up with her afterwards to make sure she sees the answer in the recording. Her question was around how evaluation is identifying needs, and knowing even as recently as this past Friday, year one, period 2 performance measures were due, year 1 evaluation reports were due. And so Teresa's question was, are TA and evaluation teams identifying potential opportunities based on these evaluation and performance measure deliverables, or is it focused more on communities identifying areas for TA and then reaching out with specific questions?
You want me to start this one, Dr. Hunter? You want to?
Yeah, I think it could go both ways. And I think it has happened both ways. So we have the communities of practice where sure, through reading the performance measures, that they've come up with topics that can assist the recipients and the sites, and as well, recipients have reached out. So I think it can go either way.
Yeah, and I thank you, Dr. Hunter. And I'll just add that the evaluation TA teams have collectively identified potential areas for TA that have been based upon the reviewing. We talked about the rubric for reviewing the performance measure reports, and also things that we've noted in reviewing evaluation reports. Those areas that have been identified, the TA team really used some of that knowledge to develop the TA offerings menu, which will be posted on AMP, shared by CDC. It also informs our past and our future TA webinars, evaluation TA webinars, I should say, that you'll hear about. So we definitely use that information. And as Dana said, the communities of practice has been a critical place to get that information and knowledge, as well as other communications with your 2109 teams and evaluators. Thank you. Back to you, Kara.
Thank you both. The one other question I'm seeing in the chat at this point in time, oh, and I also want to acknowledge many thanks to Mary, who was able to drop the link in the chat to the Telling Stories recording that Darrell and Dr. Hunter mentioned as they were talking about photo voice. So one other question I'm seeing in the chat is from Linda again. Can we enter TA on AMP regarding uploading reports to Grant Solutions? I think this is one I can take directly, and thank you, Linda, so much for the question. Sure, if you're going to submit a TA request for reporting in Grant Solutions, we'd recommend that you select the budget and administrative category. There may also be scenarios if you're already directly engaging with your project officer and your grants management specialist on an email chain, that those two folks together may be able to help you with the reporting issue directly. Since I have you all here, I'll also go ahead and drop a link into the chat for some basic training videos for Grant Solution. They may not be able to answer all of your reporting questions directly, but it's a great starting point. And this is certainly a website I'd recommend bookmarking if you're using Grant Solutions often. One other question that I'm seeing in the chat is from Gretchen. Gretchen's asking about opportunities for recipients to share results with one another and best practices. It sounds like their organization would love to share and hear what others are doing. I know communities of practice have already been mentioned once, but I want to open up the floor to all of today's presenters to talk a little bit about this, this question and your thoughts around peer-to-peer learning opportunities that are upcoming.
Sure, if I could just jump in quickly. I just want to uplift the value and importance of peer-to-peer learning. And one way that Envision has been able to offer this is through our communities of practice. And so we currently have a tribal community of practice that's going on, as well as a storytelling community of practice for both CHWs and CHW supervisors and allies. And so again, that information is available on Envision's website, as well as in AMP. I'm sorry, I don't have the dates in front of me at the moment, so I would encourage any of my colleagues who could dump that into the chat. That would be greatly appreciated.
Thank you, Lisa Renee. I'll also note that there's been a wonderful collaborative partnership with all 2110 recipients. So that's ASU, that's WASP, and that's Envision, around developing a session that will highlight and feature several 2109 projects as well as the 2110 projects during the American Public Health Association annual meeting that's coming up in November. And I look at that as one of the many opportunities where we can not just share with each other and learn about each other's programs, projects, and works, but we can also share, even while this project is going, with many others who are interested in the progress of the 2109 and 2110 experience. And as once again, those communities of practice are critical to sharing those promising practices, learning from one another, facing some of the challenges and opportunities that this project has together, as we all collectively have so much experience. Thank you.
Thank you so much.
I
Oh, go
also want to
ahead.
highlight, given that we're talking about AMP, excuse me. There was recently a case. I want to just highlight a recipient. I'm gonna put you guys on the spot. You don't need to talk about it, but Rhode Island recently developed in collaboration with our WASP partners some evaluation guides, and they actually posted them. Like if you have documents like this that you create and you would like to share with others, Rhode Island shared those documents in AMP under the discussion board, just for anyone that would like to see them. I think they're awesome. And I think if you have also examples like this that you would like to share with the CCR community, that's a good avenue to do that.
Thank you so much, Isabel. Yes, would love to see those discussion boards filling up. There's a follow-up question I want to ask while we're on the topic, and that is, if you're not able to attend a community of practice, you miss sessions or you're not able to commit to the time period, does the information or resources then get posted somewhere?
Yes, they get posted on AMP as well as Envision's website. We think it's very important to make sure that all of the resources are available to all of the recipients, whether or not they're able to participate during the community of practice as it's happening.
Thank you so much, Lisa Renee. Envision team, if you wouldn't mind sticking that website in the chat one more time, I think that would be great. And I'll add that if you're on AMP and looking for the materials from a collaboration group or from a community of practice, you'll want to go to the collaboration group tab at the top of AMP, and that's where you'll want to be looking for those materials. I want to jump back up to a question that was asked about time frame, and I think this is one I can take from Manuel. It's asking how quickly after submitting a TA request or should you expect for someone to get in contact with you? And the answer is that moving forward, we're hoping to respond to any TA request within 2 business days. So a pretty quick turnaround in terms of getting a response. You might not get the answer in that initial contact, especially if your question's more nuanced, but someone from the support team should be in touch with you within 48 business hours.
If I could just add to that, I just want to highlight that the response will come through AMP initially, so that folks should look out once they put their request in.
Thank you so much, Lisa Renee. We're nearing the end of our time, and I believe we've gotten through the questions that have come into the chat. Colleagues, if there's anything I've missed, please feel free to chime out, but otherwise I may open the floor to any closing remarks that our presenters would like to make. One more has come in from Luis. An additional question, is there any form of interpretation language resources or support that Envision can provide? Lisa Renee?
Sure. So we are very fortunate and we have the ability to provide TA in both English and Spanish at the moment. I wish there were other languages, but those are the two that we have staff that are fluent in, as well as all of our materials that are posted, the webinar recordings, the slides, all of those are available in English and Spanish as well.
Thank you so much. And thank you everyone for your participation today. We are so grateful for your questions to guide our discussion and ensure that you can get the information that you need. Is there anything our presenters would like to mention as we close out today?
I would just like to say that from the Envision team, we are excited to be able to continue to work with these CCR-2109 recipients, and we look forward to receiving your TA request.
I'd also say ditto, and please understand that we were in a historic time in the CSW movement in the US, and the CCR project is a major part of this historic moment. And we must not let that get lost on us, and we must tell our stories. So thank you for asking that question about stories.
Thank you all so much for everything. I'm going to turn it over to Courtney, who I believe is going to facilitate and tell you a little bit about a quick satisfaction poll, but thank you all so much for your time.